The coronavirus pandemic has claimed another 21 Victorian lives in the past 24 hours, the highest daily toll of the crisis so far. And there have been 410 new cases, an increase on yesterday's total. Here's reporter Stephanie Ferrier in Melbourne. So, Steph, sad news, 21 more people have died. Were they mainly in aged care?
Yes, hi Ros. Yes, they were mainly in aged care settings. 16 of those 21 deaths were part of the aged care sector, and that was 10 women and 11 men aged from their 70s up to their 100s. Now, we also heard that the number of active infections among aged care settings is now past 1,900. There are more than 1,000 active infections among healthcare workers, and the number of active cases totally is now over 7,800 cases in Victoria. But we also heard that there are a couple of rises in some of these regional areas, Geelong, Ballarat and Bendigo. Now, even though they're not that big increases, the Premier Daniel Andrews did say that because they're coming up such a low base, any rises are of concern. He also said that obviously it's heartbreaking to see empty streets and empty shops here, but people have to stay the course. Let's have a listen to what he had to say.
I know it's tough, I know it's challenging, I know that we would prefer to be in a different set of circumstances, but even at low numbers, we've just got to have that vigilance across the board so we can keep them low and indeed drive them down even further. I made some comments yesterday about people really just stopping and thinking about whether travel to regional Victoria or travel from regional Victoria to metropolitan Melbourne is absolutely necessary. And I just ask people to give that little bit of extra thought to that, and if there's any sense that that trip could be avoided, that travel could be limited, well then that is conducive with less movement, less cases and getting to the other side of this.
Steph, what's been happening with inquiry into what went wrong with hotel quarantine?
Yes, so a parliamentary probe at the moment is hearing evidence from the Minister for Jobs, Martin Pakula. Now, yesterday, Daniel Andrews refused to agree to calls for Mr Pakula to resign after a leaked interdepartmental video showed that it was his Department of Jobs that helped to set up this botched hotel quarantine scheme. Today, Martin Pakula himself was also standing firm, saying that it wasn't actually his department but the health department that had oversight for infection control. Let's have a listen to what he had to say.
The Department of Jobs, Precincts and Regions had a role in the hotel quarantine program, but it did not have operational command of the hotel quarantine program, and it was not responsible for infection control. There has been some effort gone to from some quarters to create that impression. And I have seen reportage in the last couple of days to that effect, but it's not correct. The fact is that the people from my department, whether it be from the Global Victoria team or elsewhere, were primarily responsible for things like logistics. So that would be the booking of rooms, the organising of meals and laundry and things of that nature.
There's also been a bit more light shed on that issue of private security guards versus ADF troops and the war of words that's erupted between Premier Daniel Andrews, who says he didn't believe that there was that assistance on the table, and Linda Reynolds, the Defence Minister, who says that there was. Now, we heard from one of Mr Pakula's senior government staffers saying that in fact it was announced at a meeting on the 27th of March that private security guards would be used, but it wasn't his department that ordered that. They were just there to procure the security guards. Now, just on another issue, obviously there are still more fines being issued by police. The latest count in the past 24 hours is 184 fines that were issued, including 24 for failing to wear a face covering, which of course is also part of these hard stage 4 lockdowns. I'm not wearing one at the moment because we are live to air, but I'll be putting this back on as soon as this is over. We have an exemption so that people with hearing impairments can understand what we're saying.
Stephanie, thank you. In New South Wales, there have been 18 new cases of COVID-19 recorded since yesterday. Reporter Jessie Dorset joins us with more. Hi, Jessie. So fewer than yesterday, but still up there. Take us through today's numbers.
G'day Ros. 20,000 tests across New South Wales have detected 18 new infections. One patient is a returned overseas traveller in hotel quarantine. 2 people contracted coronavirus in Victoria. 2 cases are still under investigation. We don't know the source of those. That leaves 13, and they've all been traced to known clusters in New South Wales. Of today's new cases, one person is a healthcare worker at the Hornsby Hospital. They're the second staff member there who has contracted coronavirus, but we're told they didn't work while they were infectious. A third case has been confirmed at the Our Lady of Mercy College in Parramatta. So that school will shut down for a fortnight, and all students and staff told to self-isolate for that amount of time and get tested for COVID-19. And then there's this other cluster, we've been hearing so much about it, at the Tangara School for Girls at Cherrybrook in northwest Sydney. It's grown by 2 to 19. We understand 5 of those girls from years 10 and 11 went on a religious retreat in Bargo, which is south of Sydney, but the school didn't know about that event. Let's now hear from the New South Wales Premier, Gladys Berejiklian, on today's numbers.
New South Wales continues to hold the line, but what concerns me, what concerns our experts, is over the few weeks that we've been able to hold the line, there has been an accumulation of the number of cases which, as of today, do not have a direct link. The vast majority of these are in known settings in Western and Southwestern Sydney, which is why it's really important to have community members in those areas in particular adhere to the advice we've given, but also to step up their rate of testing.
Jessie, what's the latest with the people who are trying to travel through New South Wales from Victoria to get home to the ACT?
Yeah, about 100 Canberrans are stranded in regional Victoria. It's been an anxious few days for them because of the New South Wales border closure, but the state government and the territory government have reached a deal. Those people will have 4 days to drive home, straight home to the ACT. It'll be a direct route, so good news for them. And I also have some other news out of New South Wales this afternoon, Ros. From last Friday, anyone returning from Victoria has had to go straight to a quarantine hotel for 2 weeks. The original plan was to charge them all about $3,000 for the service, but the New South Wales government has changed its mind. It's going to introduce a 1-month grace period, so the returning New South Wales residents won't have to pay for the quarantine hotel if they get home in the next month. So that's good news for them.
It is. Jessie, thank you. New Zealand's biggest city is back in lockdown after 4 new cases of coronavirus were detected there just a couple of days after the country had celebrated 100 days without community transmission. Prime Minister Jacinda Ardern has also announced new national restrictions. From Auckland, here's Anna Burns-Francis from TVNZ. Anna, thanks for being with us. Tell us about these new cases firstly. Who are they and how do they come to light?
So, Ros, that's right. There are 4 new confirmed cases here in Auckland in one household. And it wasn't until what they're calling the index case, a man in his 50s went to his doctor after being symptomatic for about 5 days and was tested. That result came back positive. The swab was run again, it came back positive again. They did a second test and then health authorities realised they might have a bit of a problem on their hands because in the meantime, this man and another person in his household had been at work. Both those workplaces now closed. All those staff there have gone home. That's nearing about 300 odd people across a number of sites in Auckland. But health authorities are not sure where this case originated from.
And authorities then have imposed restrictions. Just tell us what they've done in Auckland, first of all, and also elsewhere in the country.
That's right. So it's a place we've all been before, unfortunately, and as you would know, lockdown restrictions can be pretty tough on a lot of people. There was a late night press conference here in New Zealand, about 9:30 last night, that it was announced Auckland would go into level 3. The rest of the country going to level 2. We've been in level 1 for some time now, so this is a 2-stage jump for Auckland, our country's largest city, and that's because this is where the household has been, or they do live, and they have been for most of their time. The rest of the country's in level 2, even though 2 of the people from that household have been to Rotorua, a tourist town in the middle of the North Island. But there's no concern at this stage that there were any close enough contacts or that there was a high enough risk for anyone in Rotorua to need to be tested. They're just doing some contact tracing there, and Rotorua is like the rest of the country, level 2. Level 3 is quite different for Auckland. It means that only essential workers like myself working in the media, health workers, those sorts of things, they're the ones still going to work today, but there's a lot more masks out than there were even yesterday.
We know how hugely frustrating this current situation is for every single member of our team of 5 million. But if we get our immediate response right in this critical phase, we have the opportunity to lessen the time that we will have those heavier restrictions.
And Anna, we've been hearing reports of panic buying and supermarkets being mobbed there. How are people feeling about going back into lockdown?
Well, once people even heard there was a press conference last night, we saw queues building at supermarkets across the city. It really was a return to the scenes of lockdown level 4, panic buying. There is a lot of restrictions on items these days, so we didn't see people walking out with huge amounts of toilet paper, for example, but plenty of people going to the supermarket last night. And this morning, lots of traffic on the roads. Of course, lockdown level 3 in Auckland didn't start until midday. That's just gone a couple of hours ago. So the streets are a lot quieter now, as they're supposed to be. But certainly this morning, a lot of activity, people getting ready for the next 3 days before we find out how long this will go on for.
Anna Burns-Francis from TVNZ, thank you.